All right.
Can everybody see and hear us in live that are out there in virtual TV?
Yes.
Mark, can you hear us?
Yes.
Okay, we're going to go with
Yes.
All right, I'd like to call the Gunner County Board of Inspectors meeting for May 12th to order at 8:08 a.m. And at this time, would ask if there's any public comment or anything that's not on the agenda this morning. Yeah, you want to, just for the record, if you want to state your name and municipality so we have it for the recording.
Sure. My name is Janet Ironson. I am part of the Pennsylvania Prison Society, and I live in State College. But I'm also here to introduce Monica, who would also like to, Monica Brendel, who would also like to speak. And so I'll let you go first.
So I don't want to take a whole lot of your time. I'm just a mom who sat by the bedside of my daughter on life support and was a little angry. And I want to share why. So what I'm about to say is no reflection on CCCF as a whole, nor do I think any of you intend for it to be this way. But there's the good, the bad, and the ugly, and if the ugly isn't transparent, it can't be dealt with. Nor is any of this to discount my daughter's responsibility and her need for incarceration. And if I stumble my words, it's because I wrote nervously last night, and my hands are sweating right now, but I feel maybe today. March 31st, my daughter went to jail. April 6th, there was a hearing. My husband and I felt the need to get custody of my grandson because my daughter needed to get help. I received no phone calls from her. There was no communication from her. We don't put money on her account. We don't bail people out of jail. On April 18th, he called me at work. Mom, I'm going into OR. They have to give me blood. That was all she could say in a breath that I could hardly hear her. I said, what? She said, I don't know. I left work immediately, found out she was up there for a day and a half, at least. Before that, a friend of mine said they saw her up there. I tried to inquire about why. I couldn't because I'm just her mom. It was her personal medical information. And so I assumed that somebody would let me know if it were serious. I got up there when she called, and the doctor said to me she was almost gone when she arrived. She had a significant amount of blood loss, pneumonia, sepsis, fever. She had lost 20 pounds in the time that she was in your facility. She was dehydrated and so weak she couldn't move. I'm just a mom here. She was able to talk enough to tell me that. I thought I was going to die in there. I didn't go to the hearing on the 6th, Mom. I would have came just to see you and Dad. You did the right thing. She said at one point there was a code yellow where she passed out and urinated on the floor. She said several men came, took her to the shower, and when she was too weak to shower, they made fun of her. They made fun of the color of her urine and told her it stinks and it's disgusting. I can't even say the things she said they called her. She said she was in so much pain most of the time that she cried out and moaned night and day. And people mocked her moaning. She said she couldn't get food or water because she was too weak to make it to the cell door, so they would say she refused. She said she went to medical twice. She got something for a urine infection and Tylenol. She said she couldn't make it to the door. She was too weak to get it. She said one time she was so thirsty and thought if she could just get there to get the medication, she would feel better. She said she got to the door on her hands and knees at one point, and somebody shut the door and said she refused. Twice they took her to medical. To reiterate that, my daughter said most of the time she couldn't move. I'm a cancer survivor. I had sepsis. I laid in bed at one time all day while my husband was at work and I couldn't move. When he got home, he wanted to take me to the ER. At that point, I was able to walk out to the car. It was my will to live, to do that. I understand from Jessica that she wanted a drink of water after the incident with the shower. So someone said, but she was able to get up and walk to get the drink of water. I was able to get up and walk out to the car. She said they would call her fat and lazy and write that she refused. They told the judge the day of the hearing she refused to go because she refused transportation. She said, Mom, I couldn't stand up. I'm getting off track here. So that night, the 18th, that I went to see her, she was declining. She was life flighted to GMC Danville. This is only within a couple days after she went to the hospital from this facility. She was put on life support here, flown to Danville Geisinger. Because of the duration of an infection, the antibiotics weren't able to take care of. Her heart was so badly infected that just last week, she had 2 valves replaced. She's finally expected to make it, but there will be a long road of physical therapy. Now she will go to drug rehab and detox again, because she had to have drugs for these operations. I was somewhat relieved when she came to jail. I thought, well, maybe this will be the time that she accepts and gets the help she needs. If none of what my daughter says is considered by any of you to be true, my daughter's condition when she went to the hospital will hopefully bring about some discussion of change. Thank you for listening.
Yeah, okay.
I'm not going to talk about the specific incident of this individual, probably out of concern for her privacy. But I'm just going to share some research that I've done since the Business Society was contacted by her parents. There's an old belief that it's not possible to die from detoxing, but that belief is out of date. I'm going to pass out a list of resources that outline the most recently recommended standards of care for people who are detoxing. And I imagine that the administration of the jail here already knows about these resources, but I think everybody on the Board of Inspectors needs to be aware of this new research. Connie, who we all know as a member of the Prison Society, will have some words to say later on in the meeting, but for right now, I want to ask the Board of Inspectors to consider 2 things. One is that Crime Care do an internal review of this incident. If that isn't already routine, which I hope it is, but if it's not routine, that you ask Crime Care to do a review of this incident, and the results of that interview should be shared with the Board of Inspectors. And the second proposal that I wanted to suggest is that the opioid money that has come to Center County as a result of the settlement, some of that be earmarked to look at the issue of detoxing and what we can do to make that more humane, whether it's inside a jail or outside of the jail, wherever we happen to engage in that kind of work. The vice president of the Major County Sheriffs of America is a guy named Peter Katujian. I've never met him or know him, but he says that how to best treat opioid addicted inmates is among the most pressing issues facing jails today. Center County is already known for some progressive practices, such as the administration of Vivitrol for people with opioid addictions. A logical next step would also be for this county to become a model in the state for detox policies and practices. So, Commissioner Dershowitz, with your permission, I'd like to pass around this list of resources.
Sure, if you could, you have enough for everyone, or?
I do, actually.
Okay,
I made plenty of copies.
Okay.
And I'll send some to Denise for those people that are online. Thank you so much.
All right, thank you very much. Is there any other public comment? Not on the agenda? Is there any need for any additions to the agenda?
No, sir.
Anybody know of any additions? Okay. Okay, I'm going to turn it over to
Approval of the minutes.
For the,
You want to do approval of the minutes?
oh, okay, yes. Approve the minutes of the last board meeting. Is there a motion to approve the minutes of the last meeting? Any other discussion, additions, or corrections to those minutes at this time? Hearing none, all in favor? Aye. Motion passes. Now, I'll turn it over to Ward Shell for discussion on that correction week.
Thank you, sir. With everybody, usually in past, we always had them come in here and do that with everybody's past days, vacations. We weren't able to do that this year, so hopefully next year we'll be able to bring them in. We'll probably have it in April instead of May. A lot of people were hitting their vacations at this time, but I'm just going to go through with our 2022 National Correctional Employees Week. We recognize correctional staffs for the awards. 73 Officer of the Year is Charles Zimmerman. He's a correctional officer. He is a graduate of Bellefonte Area High School and Pennsylvania State University, where he obtained a bachelor's degree in meteorologist with a minor in geographic. He began his employment as an officer in May of 2004 at the old jail. He became an integral part of the facility's training program in a large slate of areas, including PPCT, defense tactics instructor, chemical munitions instructor, a staff trainer, and he has been part of the training all staff for many years and makes a course enjoyable. He completed the CERT operator course in July of 2009. He served as a member of the facility correctional emergency response team, completed the crisis intervention team training in June of 2014. He also became a Pepperball armor in October of 2017 as a central control officer on his shift. Chuck keeps the facility running smoothly and anticipates needs, recognizing outside agencies, effectively handling emergency response, stepping up to handle duties and visitations as needed. He is always a professional and displays good humor to keep everyone boosted throughout the day. The second one is our 311 Officer of the Year is Bryce Bennett. He's a correctional officer. He's a graduate of Phillipsburg Oliosis Senior High School and a graduate of Lock Haven University, where he obtained a bachelor's degree in business administration. He began his employment as an officer in February of 2020. Officer Bennett is a state athlete in wrestling during his senior year of high school. He credits wrestling with teaching him about the discipline and respect to carry into the workplace. During the year, he was the officer in the restricted housing unit and ran the effective and ensure everything needed as completed. Now, as a relief officer, he learned to work very independently to handle tasks without supervision. He became qualified to work as in central booking this year and is now able to work all posts in the facility. Among a crew of often newer staff, Bryce has shown himself to be a very personable and dependable resources. The 11-7 officer is Hunter Granite, a correctional officer as well. He is a graduate of Bald Eagle Area High School, completed coursework in criminal justice at Lock Haven University. He began his employment in January of 2018. Hunter is quite understated in his interactions, often going beneath the radar while quietly handling a large variety of duties that need to be done on midnight shift. He is proficient in all the facilities posts and works with little or no supervision very effectively. He treats his colleagues as part of the team, bringing a positive attitude to his interactions and helping to correct any issue he finds in a constructive way. Especially throughout the challenges of the pandemic shifts, he stepped up to ensure that everyone was safe and everything kept moving without having to be asked to meet the challenge. We're going to go to the Employee of the Year. It's our kitchen personnel. He is a graduate of Bellefonte Area High School. He began his employment at the facility in January 2018, began being with his experience as a cook at the Hofbrauch restaurant. He obtained a Safe Serve certification in 2019. He also makes his best staff. Rob always does his best to make the staff experience a good one. He often goes out of his way to get extra treats like donuts or cookies or bring in to share for the staff of his own, raising spirits with the staff. He, as part of the kitchen team, he has worked a good bit of routine overtime and does not complain or let it bring him down. His colleagues noted that he displays the utmost respect and professionalism. The Supervisor of the Year is John Milner. Lieutenant Milner is a graduate of Clearfield Area High School and Lock Haven University, where he obtained a degree in criminal justice. His employment as a facility lieutenant on May of 2011. At Lock Haven, he was founding member of the local chapter of the Alpha Pi, the National Criminal Justice Honor Society. Prior to his employment here, he was a youth counselor at the Central Counties Youth Center and then special investigator for the Pennsylvania State Ethics Commissions. His experience at those agencies were allowed him previously to act as a security lieutenant handling internal investigations. He joined the facility training program by becoming a staff trainer in June of 2013, cell extraction instructor in 2014, completed crisis intervention team training in 2014. As a senior shift commander, he has assisted in training all the other lieutenants in part through the years. He has deep understandings of the facility's operation needs to handle the daily emergent situations without hesitation. The Outstanding Officer of the Year is John Mick Jones. This is something new. We felt that Mick deserves this. He had some medical issues that he's been fighting through, and he hasn't missed a day of work since that. He's old school. Let's put it that way. He's a hard worker. He's one of those. He's a graduate of Bald Eagle High School and completed coursework at Clarion University. Prior to being hired as part of the class that would open the new correctional facility in 2005, he obtained his CDL license and blaster's license for his prior work. At the intake post where he now works, he's gotten very good and excels in this year. He is very good at dealing with inmates who are upset and combative and de-escalates the situation. Despite any personal obstacle, he continues to work the many overtime shifts without striking a no or I can't work today. He does not complain about any extra hours. As one of the senior staff here, he provides an excellent role model and mentor for the new staff and stays positive at all given times. And there's one picture of Jonesy. He will be retiring this year. That's why we felt that he was going to get the 7-3 Officer of the Year. But since we want to give him something special, so we're going to have in June, he'll be retiring on the 29th. So great officer. We're going to miss him. Just continuing on with the menu for Correctional Employment Week, Employee Week. Sunday, we had a brunch. Monday, we did a Shell's chicken lasagna, meat lasagna, and garlic bread, and that's up in the corner. Brenda helped me make that down in the kitchen. Tuesday, we had hot sausage, pierogies, and wedding soup. Wednesday, we had Hofbrauch pizza, which was the first time I had Hofbrauch pizza since moving up here, so that was something different. Now I know. The hidden secret. Thursday, the Warden's Grill. We grilled half chickens and baked potatoes, it was a nice day that day. We were able to eat outside. You see the chickens on the grill. Friday was grilled steaks, baked potatoes, and fresh asparagus. Saturday was pulled pork, barbecue, macaroni and cheese, ice cream every day, and Melanie's Desserts, of course, was there. We'll show the next picture there. There's her pictures there as well. Glenn and I kind of manned the chicken grill, and then everybody else came up with the commissioners. John came up as well as our maintenance and so forth. It was a great day for the staff. It was enjoyable for them. Any questions on the correctional week?
I think, maybe. Give our best to them.
We'll do. All right. Thank you, sir.
Also, assembly generous for the bringing his trailer with the chicken racks on it and providing that. That's added features. Correction. I appreciate some of the best of the presence for anybody. Recognize that and Melanie and everybody else who made this opportunity to make our facility a little better.
Thank you, sir. Starting off with the returning citizen service report. Starting off with Center County Mental Health, Amy Miller. A year ago was 21. This past April, she's seen 30. 7 was referred to Crossroads Mental Health Group. Crossroads is still virtual at this time. They will be coming in here in the next week or so. Drug and alcohol, they had counseling sessions with 10 returning citizens, male, 4 times per month, 2 female returning citizens, 4 times per month. The mental health group is 5 male returning citizens, 4 times per month, and 2 female returning citizens per month. Once they start coming in person, they probably will be doing group sessions, which will be beneficial for our incarcerated. Center County Compass Program, male groups is 18 returning citizens, 3 peer supports 4 times per week, for 4 weeks. Female group is 8 returning citizens, 3 peer supports 4 times per week for 4 weeks. The Compass graduation was 3. There were 3 males. Center County Decision Points Program, male group is 6 returning citizens. They meet 1 time per week for 5 weeks. Female group was 4 for 1 time per week for 5 weeks. The graduation was 2 males. The work release, centerpiece is an average of 6, maintenance average of 2, grounds is an average of 4, work release is 5, and a year ago we had 0 in work release. Center County population snapshot of Saturday, 4/30/2022. The total count that day was 166. Out of 166, 102 was Center County. Out of 102, 22 were females, 80 were males. Out of the 102, unsentenced was 54, 12 females, 42 males. County sentence was 21, 8 females, 30 males. State sentence were 10, 2 females, and 8 males. We have a run coming up next week. Next week we have 4 going to state, and then we have 1 in June. Hopefully we'll get 5 to go to state, so we'll maybe lower that. Out of the total of 166, our tentative county population is 64. Out of 64, we have 6 females, 58 males. Unsentenced is 19, 3 females, 16 males. County sentence is 44, 2 females, 42 males. State sentence is 1 female. Our daily population from the April 1st, our county, Center County's in blue is 122. At the end of the month, we ended up about 106. Tennant County, we started off with 83, and we're about down to 65. The correctional facility monthly report for the unsentenced. New charges only, male 28, females 5 with a total of 33. Probation and parole only is 6 males, 5 females, a total of 11. Probation parole with new charges, male 7, females 2, 9, with a total of males, the population is 41, females 12, and a total of 53 on unsentence. Behavior modification status, we have 4 on tier 0, 1 on tier 1, 1 on tier 2, and we have 7 that's out in population out of a total of 16 that we're dealing with. Co-occurring disorder, a year ago it was 31. We had 79 intakes, which was 39.3% of our intakes were co-occurring disorder. April 2022, we had a 27 out of 57, comes out to 47.4% of our intakes were co-occurring. Only 12 were on or have not refilled medications upon intake. Out of the 27, 26 was from center, 9 females, 17 males, and 1 was from out of county, and was 1 female. Suicide watch a year ago was 3. This past April was 8. They were from center county, 4 female, 4 males. Out of the 8, there's 3 detoxing, 3 from center, 2 females, 1 male. The detox total a year ago was 4, 2 center, 2 out of county. This April was 21, 10 females, 11 males, 20 from center, 9 females, 11 males, 1 from out of county is 1 female. Substance detox by the numbers. Heroin was 4, 3 from center, 1 from out of county. Benzo was 2, 2 from center. Meth was 1 from center. Alcohol was 4 from center, or multiple. 4 heroin benzo, 4 from center. 1 alcohol meth from center. 2 benzo Suboxone from center. 1 heroin benzo alcohol was from center. Our FIMAT number for April 2022 is 0. Received injections prior to release is 28. Second injection was 16, and of course, released inmates who have returned for follow-up shots are 7. We're in early stages right now of providing more of a MAT program with Prime Care. We'll probably be looking at Subucade for an injection for 30 days for anybody that's coming in, and we'll build that program as we see too. But I think it's a good start for us to get us. We're hoping to start things in June, July. And then in 3 to 6 months, we'll evaluate it and see what we have to add to that program. So what we're looking at with the MAT, so anybody that comes incarcerated once they come and get committed and they are on an MAT program, we'll maintain them on that MAT program. So that's a big plus that I think is going to help us out inside here. And then once we get through that, so Subucade is an injection, so it's a 30-day injection, so we can't divert that. They can't divert the medication. Vivitrol will be a complete different program for alcohol and opiates. That will be, if they're on Vivitrol, they're going to continue the Vivitrol program. So if they come in on Subucade or Subutex, we're going to continue that program as long as they're on that program. So we're just going to continue that. So whatever they come in on the MAT, if it's Vivitrol or Subutex, like I said, Subutex is more they can hoard it if they need to. So that's why we're going to look at Subucade. It's an injection for 30 days, so they can't divert the medication. So we're working with mental health right now with Kathy, or drug and alcohol with Kathy, with funding and so forth. So she thinks there's be enough funding that we can handle with Subucade.
At the state correctional institutions here in the county, the men have a choice of having a shot once a month or taking medication daily. You're not going to give them that option.
Well, that's still up to debate right now. The issue would be is it's time consuming, and it also you have to make sure they can divert that medication by hiding it in their mouth.
Referring to.
Yeah. Now the strips is an option, but pill form we're probably kind of going to stay away from the pill form.
There is no option. It's the shots or nothing.
No, it's going to be a progress. I mean, it's going to be what we're going to work it out. We haven't made anything decision yet,
Okay.
but the pill is not what we're going to be looking at. Probably we're not looking at that.
I think that you do.
Oh, we have to worry about the security of the institution as well. So.
I understand. I'm familiar with it because of my interviews with men that you.
I'm familiar with. Have some conversation.
Yes. Prime Care report, inpatient medical. 2 was there for 13 days. 2 was there for cardiac, and one was for heavy detoxing. COVID-19 numbers, returning citizens testings. Symptomatic, those 281 was negative, 104 was recovered. Asymptomatic, negative was 2,391. We had one come in last week that was positive, new commitment. We contacted all law enforcement on this. He is quarantined at this time, and we have 119 recovered at this time. Total seen by physician and PA a year ago was 90. This year is 78. Total medical transport outside physicians a year ago was 19. This past April was 9. Mental health clinician individual seen a year ago was 187. This April is 155. Psychiatrist is 93 a year ago, and this past April was 75. Mental health patients on psychotropic medications a year ago was 92. 62.2 of our ADP of 148. This past April was 101, 53.7% of our ADP of 188. Daily average patient diagnosed with mental health is a total of 124 out of the 188 ADP. A year ago, category C was 88 with 59.5%. Category D was 23 with 15.5%. In April this year, it was 111 for category C, which is 59% of our population, and category D, which is 13, which is 6.9% of our population. Our mental health stability rating, entire population, stability code A is 21, 13% of our population. Stability code B is 16, 10% of our population. Stability code C is 15 at 69% of our population. 14 is category D with 8% of our population, with a total population of 166. Our mental health stability rating by county, starting with the far left, stability code A, blue is Centre County, green is Tennant County. Stability code A, Centre County is 16, 15 males, 1 females. Out of county is 5 males. Stability code B is 10 from Center, 9 females, 1 male, or 9 males, 1 female. Out of county is 2, which is 2 males. Stability code C is 65, 47 males, 18 females. Stability code C for out of county is 50, 44 males, 6 females. Stability code D, 11, 9 females, 9 males, 2 females, and out of county is 3 males. The inmate grievances, a year ago we had 15. This past April we had 14. 1 was non-grievable. 0 was non-grievable found it. Grievable were 5, 0 found it, 3 appealed, and 0 amended at this time. 8 refused. Central Booking Center, a year ago we had 206 bookings. This past April we had 271, which is plus 65. 11-7 processed 34, 7-3 processed 115, and 311 processed 122. That's it, sir, for the reports.
Anything to under old business? Oh, I'm sorry.
Hi, I wonder, I know if I could ask a question of the word, that's right. You've explained this before, and I apologize for asking a second time, but there's an explanation of the C and D categories for the snapshot, which is like 59% C category and 6.9% D category. And then there's another explanation for the C and D category, which has different numbers. And I've never quite understood. So this one winds up, people in the C and D category represent only about 65% of the population, but the later ones have people in the C and D category representing over 3/4 of the population of the jail. And so if I want to go out into the public and say what the C and D categories is, which numbers do we go with?
So if you read daily average, this is a daily average.
Right.
So that's what we do is take the 30 days and we do an average. So that was our average. That's not there. This number here is a snapshot. It says up there in the left corner, it says snapshot. So I pulled this data on that date.
I see.
So sometimes, and it depends on when I pull that data, if I pull it in the morning or I pull it in the afternoon, it may change because of releases. So that's the difference. So medical prime care takes this one because they do it in through their program as an average daily.
Got it.
So that's an average daily, and this is our snapshot. Just like this number here is a snapshot as well, which they might be a little off from this number because all depends on when I pulled it that day.
So one is what you do.
Yes, yes. And we try to make sure, we go through the list. Especially, hold on here, especially this list, I pull everybody's name from county as well as Tennant County, and I go through there, and then within that program, it shows also who needs to be seen because they might have just got here a day, 2 days, 3 days, or 4 days. So we work with medical to find out what their category is, and then we plug them into that number. But all depends on when I pull that data for these last two ones. But the average comes from Prime Care, and that's just an average of the 30 days or 31 days.
Half of the jails in the state, right? About is what I've been told anyway. In some boards of inspectors, a Prime Care representative physically comes and does that report. Is that something you've considered, or maybe I should be asking the board of inspectors that question?
I mean, they're going to repeat the same numbers that I'm going to repeat, so I don't know what would be the difference. I mean, Prime Care is sitting right now at the end of the.
Oh, I see. I didn't realize. Hi, Prime.
So they've been in at our meetings since Cass and even when Christy was here. They've been at our meetings, so I mean, I don't see why we would have to bring one of the top executives here. I mean,
I didn't even know that. So I think that's that way.
Any other comments or questions on the board's report? I'll move ahead to old business, which is Chris, was any COVID-19 related?
With our programs right now with virtual, we're still doing Crossroads Mental Health and Drug and Alcohol Counseling. They will be coming in person because the last meeting we approved to start opening slowly. So our programs are starting to open slowly. Instead of having open the floodgates and everybody comes in, we're just trying to make it slow and keep it safe. Our incarcerated youth school, since they're done for the year, they are going to, as long as everything stays somewhat normal, if you want to call this normal with the COVID, but they're going to be coming back in the fall semester, and Inside Out program with Penn State may be coming in person with fall semester there. Or in person, of course, is our Compass for men and women, our Center County Mental Health, Chaplain Services, GED program, interviews for the Public Defender's Office, probation, Parenting Inside Out will be starting. It did. Okay, I wasn't sure. Saturday. Okay, it just started Saturday. I knew it was coming up.
Very great.
So it works a little bit better than virtual. Parenting Inside Out program, as I mentioned that, public defenders, power of attorney, prison society is able to come in. The task assessment's been coming in. We are increasing with our chaplain services, our Bible, of course, reentry we're looking at coming in sometime possibly in June. We're just doing a step program, letting people in so it's not a flood. So we're trying to get back to somewhat normal here. Phone calls, we're still doing DRS office hours, videos, access church services. In progress of adding, of course, is our leadership program with Centerpiece. So we'll be able to bring that in sometime in June or July or whenever it works out with Kathy. Ridgeline Language Arts, I'm going to reach out to the young lady and see when we can try to start her to come back in for the women's. And right now, visiting through non-contact rooms, we really don't have any programs at this time besides if prison side doesn't want to come inside the walls, they can still meet by the non-contact. But I'm not sure if Dave's been coming in. I thought he came in one time. No. I'm talking about the when he comes in to see, when Dave comes in visiting.
Yeah, he visited last.
Yeah.
Worked out beautifully.
Yeah. So, but they have the option if they don't feel comfortable coming in, you could still do it through the glass.
Yeah. Okay. But it was.
Yeah. So. Good. Just going on about our vaccine clinics we had on April 15th. It was our 12th COVID-19 vaccine and booster clinic. Moderna, we had the first dosage was 2, second dosage was 5, and the booster was 2. Pfizer, we had first dosage 1, second dosage 7, and booster was 2. Our next clinic is actually on the 17th because I just got that email, not the 12th. It's on the 17th and not the 12th. That'll be our 13th vaccination and booster clinic. And anybody that gets their first dosage will receive $25 for their vaccination. And that's it for the old business, sir, before we get into the new business.
Any questions?
The COVID-19 clinics are open to residents here and staff.
Yes.
Yes. Boulderberg Apothecary has been doing that since
We started.
June. Since June last year.
June of last year. I
Yeah.
think.
We started
The first
vaccinations,
one.
yeah.
Yeah, so they've been great to come in. Bill or
Yeah,
Bill.
Bill Faust, one of the owners, pharmacist, has been great to work with. He's volunteered his time and services to us to come here. It doesn't cost the county anything. So he comes in once a month, and he's been great to work with. So
And how has the response been from new hires about being vaccinated?
it's their choice.
their choice. We offer the information to them, but again, we it's their choice if they choose to be vaccinated or not.
We get a public list of how many officers at Benner and Rocky are vaccinated and how many are not. We don't get that from you.
That's up to the board. If they want it. To me, that's their personal.
Yeah.
That's their personal choice.
One question I do have. Vaccinated to cool off of, that, I didn't follow it close enough. Is that, they took it off the market period, or is it just, they narrowed the guardrails and who can receive it?
I believe that there was direction from the CDC to pull back on Johnson & Johnson and just keep administering the Pfizer and Moderna. And that was the direction that came from Frontier Corporate.
Yeah, I know there were some issues with blood clotting and whatnot.
Yeah.
I didn't know if that was a specific group of demographic or whether or not everybody. I haven't been one of those people that got the Johnson & Johnson twice. All right. So far, so good. All right. If there's no other questions, we'll move ahead to a new business. Chris, you want to handle the CDC or?
Yes. CDC new guidelines just came out the other day. So we've been waiting on these for a while. We knew, like I said, I've been working with Leslie Higgins, and we're just waiting on her to give us that go. We do have a webinar. They canceled the first one, but they sent out the guidelines. So we read through it. So what they did was they made two different categories: strategies for everyday operations, which always keeps the place, even the community. And in fact, the facility level factors are low. So that's what we do every day. That's they haven't really changed that much. We haven't done. There's a couple changes in there that I'll show you that they recommend. Also, the enhanced COVID-19 prevention strategy is when the community levels is at medium or high, and the facility level factors indicate a risk. What they consider the facility level factors is number of cases in the facility. That means staff as well as returning citizens. If we have a high number, one isn't a high number inside the correctional facility as long as we have them isolated and on quarantine status. But if we start getting a lot more, then we would have to pull back to the enhanced prevention strategy. We look at, when we look at the facility level factors, we look at the community level, see where the community levels is, if it's medium or high or red or yellow or orange. The facility structure and operation characteristics, what that means is basically how's our population, how's our dense housing arrangement, how's our ventilation ratio of air, fresh air. So if our ventilation system kind of breaks down or something, we have to get worked on and so forth, we need to pull it back because we're not getting enough fresh air into the facility, which everything's up and running. Maintenance has that all in computerized programs, so that's all good there. Assessing returning citizens or new commitments coming in, how many are coming in as being positive or and so forth. So that's how we kind of figure that out when we look at the facility level factors. There's a whole Excel sheet. When I tried to download it, the words was really small, and I tried to remake it ourselves, and it was just too much. So what I did was, here's what we currently do with protocols at the Center County Corrections. We mandate mask wearing for all staff and returning citizens as well as visitors. Staff and visitors required to complete questionnaire and temp checks. New commitments is on 10-day quarantines, testing on day 1 of commitment, day 5 and day 10. Testing for any staff or returning citizen at request or with symptoms. Programming is virtual / it's kind of in person. Positive cases, when we have a positive case on one housing unit, officers wear N95 masks in direct contact. The officer wears gloves, face shields, and gowns. A positive case, more than one housing unit, all staff are mandatory to wear N95 mask, and of course, in direct contact, they must wear the full PPE, wear gloves, mask, shield, and gowns. Rigorous cleaning schedules. What we're asking the board to look at, that we're looking at with the new protocols, is making optional mask wearing for all staff since our levels are low. That is an option. Visitor required to complete questionnaire and temp checks. Possibly remove the staff from doing that. New commitments, we'll keep that the same as 10-day quarantine. Testing on day 1 of commitment, day 5 and day 10. Testing any staff member or returning citizen at request or with symptoms. Programming will be in person. We're still going to just do virtual, but doing the STEP program of bringing people in. And then we still do the positive cases. At any given time, what we're looking to ask for the board that we make that decision. If we see our levels starting to increase, as well as the community and our facility increases, then we pull back. We go back into masks. We go back into N95 is what we need to do. But as we're staying low, I think we can move into these new protocols with making mask optional, and so forth, and move more into more of our programming. And then, like I said, if we have a hiccup, we just pull everything back until we get to those better days. So. They have all the other facilities have already pulled back with masking. They pulled back. They've been doing some in program. We've been following the CDC from day 1. So that's why we stayed on this program the whole time until the new guidelines came out. That's why I didn't come to the board and say, well, yeah, we have 30 prisons doing this, 20s doing this, or whatever. We stayed on the same course as CDC. So I didn't want to change or get off the track. We stayed on the track. So now when they have new guidelines where they're saying that masks should be option, the questionnaire and temp checks is optional for staff, and so forth. So I'm just putting those back in our new protocols of what we're doing. So I mean, I can get a list of what everybody's doing, but I know a lot of the facilities have made their mask option. There are some facilities that have never mandated mask inside their facility, even when they had positive cases. That's just the way they ran their facility. We just stuck by CDC guidelines, and went from there. So.
Following the scientists to study and to be guided by that. So I appreciate that you've been doing that this whole time. And it makes sense to me to continue to do that. I do like hearing that you are monitoring very closely. And so you can kind of dial up or dial back as the situation might warrant. So I would be very comfortable with that.
I'm actually going to ask a question of the medical folks in the room. What your thoughts are?
I believe that it would be nice to have them optional, and like Gordon and John said, if we need to pull back and go back into masks, I don't think it would be a problem. We communicate very well on concerns, COVID positives. I think this facility handles COVID very well, and I think it would be a great step to get back to some normalcy in the building.
No, I guess I would ask, Mark, you're out there. I don't know who else is on the call. Who all's on the
Mark Samsel was. I can't see the list right now, but I know I had Commissioner Higgins and Sheriff Samsel on the call, and Gail.
I'm here, but I'm about to get off.
Okay, so we do have a quorum.
Yeah, we do have a quorum. So.
Yeah, I'm here too. Commissioner Higgins.
They're asking for a motion to move on to the new protocols.
I make a motion to move on to new protocol, Sheriff Samsel.
Second, Commissioner Higgins,
Well, we got a third. So
unless somebody already seconded.
Okay, any other discussion? Any other, oh, I'm sorry, go ahead.
On housing units where there is an infection, you're saying that the staff is wearing N95 now,
Correct.
but the residents are not.
They are, he's on quarantine. Usually they're in a quarantine unit. It's,
Anybody else?
there is other individuals, but they're also on lockdown. It's in our RHU, if I'm correct.
Yes.
That's where he got moved to at this time.
And that individual wouldn't have contact with any other inmate except officers when they need to move them. That's why we put the officers in the gown, face shield, gloves. And then when they're done dealing with that individual, they remove all that stuff, put new gloves on if they need to or they need to do. So that person's not in contact with anybody else in the housing unit other than staff.
But they are in the housing unit together. From being totally protected, the officers, but the other people in that unit are not totally.
CDC came out that
Understanding that?
COVID does not go through the air ducts. CDC had a webinar probably a year ago about that. They did studies. It does not go through the air ducts. I'm just telling you what the webinar I was in when it was for Correctional Detention Center.
I don't understand that. Reading everything. So that's just my concern.
Okay, any other? All in favor?
Aye.
Both eyes.
Opposition? Hearing none, motion passes. Okay, here we go. All right, the next item is actually something that I had talked to Commissioner Pike about putting on the agenda after some conversation with, well, not only Kathy and Centerpiece, but a bunch of other folks, including some of our returning citizens that we're helping out down there. And that is the at Centerpiece right now, when folks show up to work, they are in orange jumpsuits. And I think there's some obvious stigma attached to that. And I think there's a lot of questions about whether or not that's the most appropriate manner possible. I understand how we got there, but I think, looking at it under a different set of lenses, I think we need to have a conversation today about finding another way to clothe those individuals as they come to work at Centerpiece. And from my personal perspective, folks that go out on work release are going to go out in whatever gear is required for their job. So I think it's worth a conversation here today about what we need to do to get that clothing change accomplished to reduce that stigma, and I think also make the public more comfortable with in the situation as well. I think there have been several times that folks have been mildly intimidated by the fact that there's somebody in an orange jumpsuit there. I think we can rectify that problem. So I will turn it over to Chris and probably to Kathy.
Yeah, Kathy, are you on there?
Yeah, I am.
Okay. Kathy's been emailing me, and with my schedule, it's been a little bit filling over the side. But we've been considering this. I've talked about it, and I agree. Anybody that was with the way we redeveloped the work release and the way we do the STEP program, I think it secures it. And I'm pretty sure everybody's down there at Centerpiece right now is working very well with each other. We don't have any concerns that they may walk off, but you always have those hiccups. You never know. But I think the way we have our STEP program and work release, there's a good possibility that we can move into giving them some type of Centerpiece shirt, maybe a brighter color, jeans, or some type of pants. It's just basically be a non-jail identifier. So it'll be part of Centerpiece's work team. That's something I have no problem with. We would give them so many uniforms, or however Kathy and I could work it out. They'd get washed every day and then go back into their bin for them to be able to have clean clothes the next day, or have a couple different clean clothes. So I have no problem for that. I know a lot of other facilities do that. They have their civilian clothes and they go out there community reentry as well as work release, or doing any just volunteer work. So, Kathy, you have anything else?
Yeah, just that, we're happy to supply. We started probably a year ago with the uniform. Anybody who's out on the floor, anybody who's working on the truck, we have Centerpiece t-shirts, Centerpiece sweatshirts, whatever the weather calls for. So we're more than happy to supply, whether it be 5, 6, whatever, t-shirts, sweatshirts per person. So that, if laundry is done once a week, then it's taken care of. Whatever, Chris, we can work that out.
Okay.
Right now, everybody wears, it's like a charcoal gray shirt because it covers, they get dirty. So, I mean, it wears that, it lasts longer, with a logo on it. But I'm happy to flip that to a brighter green shirt with the logo or something that will work. Something that is suitable to you guys. And like I said, Centerpiece will supply them. If you're out on work release, I think those uniforms are probably supplied by the company. We're happy to do that.
Okay.
There's people do not understand. First of all, the public in general does not understand who's at the correctional facility. If you ask most people, they'll say it's a bunch of college kids. It's not. But they also don't understand that at Centerpiece, who we have there. When they see the orange jumpsuit, it's actually really sad because we work very hard to uplift individuals, but yet you have customers who will walk by and say, I don't know what you're in for, but you deserve it, or they move aisles so that they're not, it's sad. And all it takes is that to happen. And a lot of what we've done has gone away. So that's my 2 cents.
Kathy, this is Steve. Do you have any problem with working with the warden and getting this accomplished if we take this action today?
Yeah, no problem whatsoever.
I guess I would ask for a motion to approve the warden to work with Centerpiece to develop a wardrobe suitable and appropriate for the work release. Thank you. Moved and second, Judge Oliver and Controller Moser second. Do we have any other discussion or any other comment from anyone in regard to this? Hearing none, all in favor? Aye. Aye. Opposed? Motion passes. And thank you. I think that was an important one to take care of.
Thank you. Thank you very much.
And thanks for your willingness to work with staff here and your continued good work.
Oh, thank you.
And by the way, Kathy, you had a lot of I got at least a lot of encouragement as I try to get my frequent flyer miles from Centerpiece. I talked to your folks down there and it was unanimous that this would be a good idea.
Yeah, no, thank you for that. They had told me that you had talked to them. I'm going to apologize now because I need to jump off. I have another meeting that I've got to get into, but I do very, very greatly appreciate the willingness to let those guys out of their orange. So thank you.
Thank you. All right. Monthly reports. Carrie.
I'll just briefly update the board that the coroner's office has shared with us that we currently have 4 documented drug overdose deaths so far this year, which is approximately where we were last year at this time.
Okay, thank you. And we update that monthly, so everyone agrees with that. Shannon.
I'm going to, well, first of all, we are visiting with people in person, and that's been a significant improvement in our ability to be in touch. The counselor's office has been excellent also in terms of the phone calls. So thank you for facilitating those visits. I'm going to turn the mic over to Connie.
Okay, at the beginning of my parenting classes, I asked everybody how they're feeling today. So I'm going to tell you how I'm feeling first before I make my remarks. I'm very sad and I'm very angry about situations that have been reported earlier. Some of you know that the reason I joined the Prison Society was because I was mistreated here at the correctional facility by the medical department. When I couldn't get any resolution from the staff at that time, I went directly to Crime Care Management in Harrisburg. I was finally satisfied with their results. At that time, I made a commitment to speak for those who couldn't or wouldn't speak for themselves. The situation we have recently witnessed with detoxing has really angered me. We at the Prison Society have formed a subcommittee on medical care, and I'm chairing that committee. I have, through the Right to Know law, asked for the correctional facilities detox policy. That was sent on April 27th, and I have yet to receive it. I, along with Janet, am doing research on best practices, contacting local providers to access the current needs in our county, and plan to share our findings with you as we go along. We want our county to be a model for addressing this complex issue. And I think we need to be asking this question. What can I do to help someone today? Thank you.
Say something. The night before my daughter was in the hospital, almost gone. I understand she was refused by the doctor to go to the hospital. And the doctor said she would have been long beyond the detox period.
Thank you.
Person, I came for just one reason. I was having a conversation with someone yesterday at Penn State. They had a department there related to what I do, what I care about. And she asked what the problem was. She just said, "What's the problem with jails?" And I said, "Well, there's a lot of good things that go on in our county facility." And I talked about the administration and the good things that they're doing. I think it comes down to people. People's the problem. And I don't know where you are on your salary review, but you get what you pay for. In the CEOs, we're making fun of this young lady, and you get what you pay for. So I'm hoping as you consider this, maybe it's already a done deal. I know nobody likes to spend money, but I think with you get what you pay for. And then that comes responsibility too. So if you pay somebody good money, you can hold them more responsible as well. So that's just my 2 cents. And I hope I hope the correctional staff gets the money that they deserve.
Okay. All right. Thank you. All right. Third piece. Capital.
She's off, so.
Any announcements?
No, man.
Anything else to come before the board this morning?
Do you want to introduce John?
He's been here for 4 days. So.
5:31. 5:31.
Very, very fast. Part of the if there's nothing else to come before the board this morning, that's the motion to adjourn. Properly moved and seconded. Any other discussion? Not all in favor? Aye. We are adjourned.
On the-
Next meeting is June
I
9th.
appreciate it.
And presuming that everything stays on track, we'll meet back.